Good day, everyone. Can you please confirm if you can hear me very clearly? Can you just unmute and confirm that you can hear me clearly?
Yes, for me, I can hear you clearly.
Okay, thank you very much for the confirmation. So once again, good day, everyone. It's my pleasure to welcome you all to the Ademolu Healthcare and Business Consulting monthly webinar series. We are excited to have such a diverse and engaged audience joining us from different parts of the world. Thank you for taking the time to be here today. We appreciate your presence and commitment to staying informed on important global healthcare development. Today's discussion will focus on a critical and timely topic, President Trump's executive order on USAID, what it means for Nigeria and Africa's healthcare system, and how the region should respond. We'll be giving just 2 minutes, maybe just to allow more audience to join us. Before then, we'd like to appreciate and thank the organizers and sponsor of today's program. That's the Ademolu Healthcare and Business Consulting firm. So I would also like to introduce to us who we are and what we stand for in Ademolu. So Ademolu is a global consulting firm that transforms healthcare businesses through medical business education, healthcare management training, health system strategy, and operations improvement. Ademolu is the first firm to introduce medical business education into the Nigeria health system and landscape. By doing this, we introduce a catch them young approach into medical school education by training healthcare practitioners to be better business and healthcare managers, entrepreneurs, and strategic innovative thinkers. So one of the strategies that have been injected into the system to accomplish this is our monthly webinar series. So for this month, that's the month of February, our discussion today will focus on the topic President Trump's executive order on USAID, what it means for Nigeria and African's healthcare system, and how the region should respond. It's something very well known to us, the significant role of USAID in funding and supporting healthcare initiatives across Africa. The executive orders related to its operation can directly impact healthcare policies, funding allocations, and program implementations across the continent. Therefore, understanding these changes is essential for healthcare professionals, policymakers, and stakeholders to navigate the evolving landscape effectively. So today's session, we aim to equip participants with the knowledge and insight needed to proactively address challenges and adapt to policy changes affecting the healthcare development in Africa. So my name is Yusuf Ekundayo Mustafa, and I'll be the moderator for today's session. We are privileged to have a panel of distinguished experts who will provide deep insight into today's discussion. But prior to that, I would like to read out to us some housekeeping rules. Firstly, I want to encourage every one of us to please keep our microphone muted while the presentation is on. Secondly, we'll have the Q&A chat box for questions and answer. And in a situation where you have to make contribution, you can use the emojis for raising your hand so that you can be called upon by the moderator. Then secondly, or thirdly, I will request that we keep this session on a schedule. Let's be mindful of time when speaking or contributing. So we appreciate your cooperation, and we look forward to a productive discussion. So we have two panelists for today's session. Firstly, we have Dr. Ademolu Owoyele, who is the managing consultant, Harley and World Healthcare and Business Consulting firm. And we also have Dr. Moussa, who is the head of consultancy African Health Business in Kenya. So the first speaker for today will be Dr. Ademolu Owoyele. So before we call upon him to have his presentation, I would like to read his profile. Hello, the IT, please, can you display his profile? Oh, this looks blurry. Okay, Dr. Ademolu Owoyele is a specialist. No, just don't enlarge it. It's okay the way it is. Let me just manage to read it out. Though it's blurry, but I'll manage to read that. Okay. Dr. Ademolu Owoyele is a specialist in business and healthcare development with a strong background of the service and healthcare industry. He's a medical graduate with postgraduate training and certification in health, safety and environmental management, and health resources management from the National Postgraduate College of Nigeria. He holds a master's degree in business administration from the University of Bradford School of Management, United Kingdom, and a member of the International Institute of Business Analysis, Canada. Overlaid onto this basis is a wealth of experience and knowledge gained nationally and internationally by training and work programs in India, South Africa, Cote d'Ivoire, Kenya, Ghana, and amongst others. His experience has spanned virtually all sectors of healthcare system, from clinical practice, managed care, pharmaceuticals, medical laboratory and diagnostic, business and healthcare consulting to hospital setup and management. His expertise lies in transforming healthcare organizations, developing corporate and business unit strategies, implementing change management system, and creating market entry strategies while growing market share. Dr. Owoyele's clinical background involved roles with Lagos State Healthcare Service Commission, Nigeria Army Reference Hospital, and Med-In Specialist Hospital, among others. His management skills were molded having worked with industry-leading multinationals corporations such as the Patcare Laboratories, now Synlab, and Lancet Laboratories from South Africa, and Novartis Pharmaceutical from Switzerland. In 2013, he assumed the role of Chief Operation Officer of Eco Corporation PLC, Nigeria's only publicly quoted hospital group, owners of the Eco Hospital, and untimely in 2019, he was appointed the Chief Executive Officer of the same establishment. He is widely known as the youngest C-level executive in over 40 years history of Nigeria's only publicly quoted hospital group, Eco PLC, owner of the Eco Hospital. He is the founder and managing consultant of Harley and World Business and Healthcare Consulting, a business and healthcare consulting firm that specializes in capacity building, business transformation, hospital and laboratory setup, operationalization as part of its area of focus. In 2020, he co-founded Harley and Rainbow Specialized Laboratories and Diagnostic, one of Nigeria's leading molecular laboratories, which was a member of the Lagos State Consortium of Laboratories in the fight against the COVID-19 pandemic. He was also appointed as the Chief Executive Officer of CarePoint Hospital in the same year. Dr. Ademolu is presently the Managing Director and Chief Executive Officer of Harley and Rainbow Specialized Laboratory and Diagnostic. He is a consultant and advisor to GuidePoint Global Advisors, USA, popularly referred to as the Business Doctor. He manages, supports, and consults for several businesses, both within and outside the healthcare space. He is a recipient of the Nigeria Achievement Award for Healthcare Management and Healthcare Consultancy Services, and also a recipient of the United Nations Polar Peace Ambassador Award. Dr. Owoyele constantly gives back to the community through various initiatives and partnerships, which has earned him numerous awards within and outside the healthcare industry. He continuously strives for excellence in service delivery and human capacity development. So permit me to welcome to you Dr. Ademolu Owoyele, popularly known as the Business Doctor, to have his first presentation, and you have just 25 minutes, sir. So you have the audience. Thank you very much.
Okay. Okay. What do I say? Good morning, good afternoon, good evening, depending on the part of the world you are joining us from. I've been introduced as Dr. Ademolu Owoyele, the Business Doctor. I'm the Managing Consultant for Harley and World Healthcare Business Consultant. And it's important that the topic of discussion today is something that we all need to pay great attention to. It's something that I feel the world is not paying due attention enough, because I feel that it's something that should elicit us to begin what we call the crisis mode. Because if we look at the fact that international funding right now is beginning to trickle down, is beginning to reduce, and the impact international funding could have on global health in general, and not just global health, but the entire economic ecosystem of the world, then it's something I feel the entire world needs to begin to look at. So without wasting much time, allow me to introduce you to the outline of my presentation today. And to do justice to this discussion amongst us, I will be using the outline of this, the outline in front of me, a very simple outline. The first thing I'll be looking at is the role of the USAID and international funding, overview of that. So we need to also look at the background of international funding and USAID in general, because a lot of focus has been put at USAID, but it goes beyond just USAID. We need to look at international funding in general. What is international funding? It goes beyond just USAID. So we need to look at international funding in general. What is international funding, and what is the role and impact this could have on global health in general? And not just global health, as I said, the entire economic growth of the world, economic ecosystem. Then we look at the statistics around international funding. This is what will help us to really see the enormity, or how big or enormous the challenge ahead of us is by the time we look at the statistics. Then we also look at the POTUS executive order. That's the President of the United States of America, the executive order itself on USAID. We need to understand the key provisions of the order. We need to understand the rationale behind this. It is by understanding the rationale that we'll be able to chart a way forward for ourselves Because if we do not look at the rationale, then we may not know how to actually begin to move forward. So this will be very important for us. Beyond that also is to understand the role of international funding and USAID in Nigeria, because that's the focus of our discussion. We are looking granularly at the Nigerian market beyond the African market. So beyond that also, we look at the business ecosystem around international funding in Nigeria, the impact the funding gap can have on global health in Nigeria. Also, how should Nigeria respond to the potential funding gap? There's already a response, but we need to also assess this response from the government of Nigeria. Is it adequate enough? Is this something that we need to improve upon? Then again, we look at what we call the crisis mode or the usual business mode, because I feel that we need to be in a crisis mode right now. So we need to go together. Then what are the innovative or emerging business or funding models in healthcare? We begin to look at the other innovative ways whereby we can actually source for funding beyond foreign aid. So this is very important for us before we now conclude on our discussion, and also raise recommendation, because the purpose of this discussion is for us to be able to bring out recommendation that can help policymakers in shaping the future of healthcare in Nigeria and also in Africa. So allow me to introduce my topic of discussion today, which is President Trump Executive Order, the impact on the Nigerian global health system, and also what response should we be looking at. So the first slide in front of me talks about the background of the USAID and International Fund. Number one, what is international funding? These are basically financial resources to support projects and programs in other countries. So basically, we're talking about financial resources, money, funds from other countries that goes into other countries to support what? Certain projects and programs. Yeah, and this could be what? From governments of other countries, the Norwegian government, the American government, the Australian government. This can also come from organizations. Example, as we have over there, the Rockefeller Foundation, the Ford Foundation, and the rest of them. So it's not just USAID that gives money. So different other countries, USAID is just from the United States government. Other governments also give a lot of foreign aid to countries, to the Nigerian system. So other sources of foreign aid will also be individuals. The like of Dangote could decide, the like of Bill Gates could decide that, okay, they want to give foreign aid to other parts of the world. So that's the sources of international funding. So what are the types and purposes of international funding? Number one, development assistance. The reason why people give international funding or foreign aid is to support, assist, and also help to develop other countries. Is to support, assist, and develop other countries. And secondly, humanitarian aid. Some countries may have challenges with conflict, with war, just as we have in Ukraine. So a lot of times, countries actually donate funds to support such humanitarian causes. Beyond that also, foreign direct investment that comes from other parts of the world into your country, these are also examples of international funding. By the time the World Bank is giving you 100 million in US dollars, those are international funding. So money coming from the World Bank, money coming from the IMF, all this falls under the category of what? International funding. So now, bringing it down also, grants. A lot of research work that goes on in our universities and the rest of them, they are all supported by international funds. Loans from other parts of the world, as we said earlier, all these come from international funding. But the USAID, what? Number one, the USAID is an independent agency of the US government responsible for administering what? Foreign aids and development assistance. So the part of the United States government that is responsible for administering the US aids to other countries is what we call the USAID. Just as I said, the Norwegian government, the UK government, all of them give international aids. But the arm of the US government that is responsible for this is what we call the USAID. And now let us look at the mission and objective of the USAID. Number one is to end poverty through what? Economic development. Look at the areas which I colored yellow. Those are the key things we need to understand. Number one, end poverty. What it means is that when there's a bridge, when there's a gap in these funds, that means the capacity of countries to be able to end poverty may be impacted. Number two, improve global health. What it means is that if there's a freeze on this fund, the capacity of countries to be able to address global health challenges, the likes of HIV/AIDS, the like of malaria, the likes of tuberculosis, may be impacted. And also promote good governance and human rights. Beyond this, also support national security. Look at Boko Haram, look at banditry. A lot of support comes from the United States agency to be able to curb this insurgency. So it goes beyond just healthcare. You know, the discussion we're having today entirely goes beyond healthcare because it has serious implications for the entire economic growth. And now, by the time this fund is reduced, what it means is that countries will now begin to prioritize, you know, allocation of their funds. And this is how other things may begin to be affected. So it affects every one of us because there will not be prioritization of funding. So now, the world has seen, now we need to look at the trends in global funds, you know, in international funds. The world has seen a significant increase in global aid from 1960. It's been seen that it's been increased about sixfold, about 6 times what we had in 1960 is what we have right now. So there's been a general increase in global aid. But much more recently, in the last 5 years, there's been a decline in global aid. And this is a pointer to the entire African nation that is not the same thing that we had before. There could likely be a dwindling, you know, global aid to African countries. So these are pointers, and we've seen it in the last few years. But Nigeria as a country, Africa as a continent have not taken notice of this until we now have Donald Trump striking the world. Now, global aid was about what, $220 billion in 2023. The entire aid from foreign countries all around was about 220 billion in US dollars in 2023. Of these, 59.6 billion was to African countries. That means about a quarter of the entire aid globally goes to African countries. About 25% of what aid that goes on in the entire world goes to African countries. So what it means is that if there's a freeze on USAID funds, we may have about 25% of these funds, you know, not being available for use. What it also means is that there will be prioritization of, you know, of other funds that is available. What it means is that global health will be affected, humanitarian aid will be affected, every other thing I mentioned earlier will be affected. In 2012, about 10.3% and 30.7% of these funds went to what? To health sector and humanitarian respectively. So what we're saying is that over 1/10 of the entire aid, you know, is what goes to global health. Nigeria received an estimated $1 billion in US dollars from the US in aid. So what the Nigerian government gets from the United States of America in aid is about what, $1 billion US dollars, you know, and that is something significant. So if this is cut short, our healthcare system that is relatively deplorable will be worse impacted. Now, and it is also important to know that whatever we get from all these countries is not enough to solve our healthcare challenges. It's not enough to solve our economic challenges. So now, by the time this is also now cut short, that means that we're going to be in a worse situation. The US government provides about what? 25% of the entire global funds. I said this earlier. Countries to be impacted by the freeze on USAID international funding are what? Are the low-income countries, countries in conflict. Low-income countries, a lot of them are in Africa, but people call us low-income. The reason why people see us as low-income is because we have not actually taken the right decision to be able to move ourselves from this mindset of low-income country. I think this is the time right now for us to be able to take the bull by the horn and chart a new course forward. So really, for me, I'm without talking about the merits and demerits of Trump's order, you know, I think it's more of a wake-up call for us to chart a new course for ourselves, for us to be able to develop our capacity to be able to, you know, for us to be able to grow. And I'll be talking more about this later in subsequent slide. Now, it is also important to know that what Israel and Egypt are exempted from this law, from these freeze, and also some other things a few other aids are exempted. Now, it's one of three things that may happen after the freeze. The freeze is only happening for about 90 days. It's one of three things that may happen. We may either have a complete termination of the entire program, which means that we're not going to get our funds. Number two, we may have a continuation of the program. The program may continue. Beyond that also is that there may be a modification to the program. So this is one of three things that can happen after the 90 days freeze that the president have set out. Because the idea is for them to be able to assess and evaluate what they've been doing. Because there are feelings that there are lots of inefficiencies, There are lots of wastages within their own system over there. So this also tells us that we need to look at our system back home. We need to look at the inefficiencies that may be happening in our own system. We need to look at the corruption. We need to look at the wastages that may be happening, and we may be able to actually fund our healthcare better, and we might not even need foreign aid. So this is part of the reason why I feel that, this freeze, it's something that, may be good for the country, may be good for the continent eventually, because it's going to be a trigger for us to, do the right thing. Yes, whatever for me, for whatever cost, the president decides to take, whether it's going to be a termination, continuation, or modification, I feel that Africa and Nigeria has no business with handouts from foreign countries. That is the truth. Because the idea behind international funding is that other richer countries who have a better GDP, who have a better economic system, they give aids, who have better resources. They give aids to countries that do not have as good resources. But the truth of the matter is it true that is it true that Nigeria do not have resources when we compare them with these countries? I do not agree with that. But rather is the management of our resources, which is what we need to look into. So there's no reason why Nigeria and African countries should rely and depend on foreign aids. Next slide. Next slide, please. Next slide, please. Next slide. Do we have the IT there? Okay, so ready? Okay, so now let us see how let's understand the protest executive order the more. Let's take a more granular look at the order. Number one is a suspension of aid for 90 days. As I said earlier, is a suspension, and there are three directions in which this can go: either a termination, an amendment, or a return to USAID support. Now, and there are certain exemptions, definitely: life-saving medications and humanitarian aids, review and realignment with American interests. That's what the Trump administration has told us. They want to have a review. They want to realign, what the USAID do with the American people's interest. USAID operations is already disrupted, all over the world. In Nigeria, it's disrupted already. The operation is disrupted. A lot of things that has currently been done by USAID are stopped. They are not able to, address, HIV/AIDS medication and treatment in HIV people living with HIV. They are not able to also address other humanitarian challenges. The PEPFAR program that is in about 54 countries, including Nigeria, is disrupted. As I said, either way, for me, I feel that it's a time for us to actually take chart another course, and it should be something very good for Nigeria. Next slide. So now, I said earlier that it's important for us to understand the rationale behind the order, the reason why the president of the United States decides to have a freeze. Now, number one, the reason is because there are allegations of inefficiencies and wastages within the USAID system. The government feels that the USAID system is fraught with a lot of inefficiencies, a lot of wastages, a lot of corrupt practices. Now, and this is the reason why I also feel that we need to take that with us, bring it back home, and begin to look at the inefficiencies in our system, the lack of transparencies, the lack of accountability in our system. Because now research has actually told us that the global spend in healthcare all over the world is about $7 trillion. That is the global spend in the entire world. That's the global health spend. Of this $7 trillion, 25%, up to 25% of it, that is about 1.5 trillion in US dollars, goes down through corruption. And what the WHO has told us before the break in my discussion, US dollars is the global spend in healthcare. About 25% of this goes down through corruption. That means it comes to corruption is waste. That means is that we may actually not need foreign aid in the world if we are a little efficient, if we're a little bit more accountable for what we do. So this is the pointer I feel that we need to bring back home. So for me, a lot of international funding programs are marked by inefficiencies and poor accountability, even from NGOs, because these funds are sometimes free money. So that is the idea, that is the mentality around the money that comes from overseas. People feel that they are free money for that reason. The accountability is poor, the transparency around this is poor. There's so much inefficiencies. So what we need to do in this case is that we need to begin to change our mindset from feeling that healthcare is free. Healthcare is never free anywhere in the world. It's either paid for by someone, by somewhere else. Anyway, somehow. Healthcare is paid somehow by somebody, or anywhere in the world. So I recommend a C model. What I mean by the C model, I'm going to discuss it later. The C model of response to the funding gap. This is what I feel the government needs to do, and I'll talk about it later on. So we need to begin to have a business orientation to how we handle healthcare beyond the philanthropic, beyond the charity mindset. Healthcare needs to be seen as a business. When you see healthcare as a business, then you know that it must create value. It must create value for people. It must also yield returns for the people that have invested into it. This is the orientation. This is the mindset we need to have people come with. Now, let's understand the role of international funding locally in Nigeria. And there's no better way to look at this than the numbers. What are the numbers? The Nigerian healthcare budget is usually below 5% of the entire budget. The recommendation by the Abuja Declaration is what? 15%. And what we are doing is always below 5%. This is always the reason why we are not able to do the right thing. This is always the reason why our doctors are leaving the country. This is the reason why most of our hospitals, the government hospitals, are not doing well. And this is part of the reason why we feel we need foreign aid, because we continually do what? Do not allocate enough for what? For healthcare in our budget. So consistently, we are always allocated below 5%. Nigeria received about 1 billion in US aid from the United States of America, 1 billion in US dollars. The presidential initiative for unlocking healthcare value chain. President Tinubu recently enacted this parastatal to ensure that they can improve, local production in the country. A lot of what they do comes from what? From USAID. What it means is that this is going to be impacted. A lot of what they do comes from international funding. So what it means is that if there are no provision for this from our government, from our people, this is going to be impacted. International funding boosts the economy in direct and indirect ways. There are so many ways. A lot of things that come into the country from international funding, a lot of our businesses, they get benefit from this. Hotels, for conferences, for things like that, all these things are improved upon because we have these funds coming to the country. And once there's a freeze, all these things may begin to cease. So it has a what? It has a global effect on the entire economy, not just healthcare. What is the implication of a gap in international funding? What is the implication? Let's look at this, this specifically in the Nigerian context. Number one, global health. There are implications for global health because USAID funds and other international funds support HIV/AIDS program in Nigeria. What it means is that the support given to the HIV/AIDS program in terms of drugs, in terms of medication, in terms of treatment may likely cease. What that also means is that we may have more people, going down with morbidity and more people going down with mortality, meaning that you may have more deaths. Because once you lack the capacity to respond to this, you may have more people dying. That's what it means. And you may also begin to have the incidence of HIV increasing. In recent time, we've been seeing the incidence of HIV actually reducing. What it means is that we may now begin to have the incidence of HIV increasing. And apart from that, also, more people may be thrown into poverty because a lot of the people that battle HIV, they have to sell some of their assets to be able to care for themselves. What it means is that more people will have to sell their assets. That means that more people will be thrown into poverty. So this is the vicious cycle around, around the funding gap that's likely to happen. Then secondly, we talk about humanitarian aid, life-saving humanitarian assistance to vulnerable population, whether in Maiduguri, whether as a result of Boko Haram insurgency, banditry, all this, the capacity to be able to address this maybe also be limited. Now, there's something called the WASH program from the USAID. That's the Water, Sanitation, and Hygiene program. This is likely to be impacted, and you know what cholera has been doing to the country in the last 1 or 2 years. We have a higher case of cholera infection in the country. So definitely when the freeze eventually goes through, this program is likely also to be affected. Food security and agricultural development. There's something called the Feed the Future initiative. This initiative already has been stopped, and this is an initiative in which over 3.6 million farmers have been empowered over the last few years. So what will happen is that you may not likely have that capacity development again. Economic growth and trade. There's a lot of capacity building that comes from the USAID to the Nigerian people. All this may also not exist any longer. Yeah. So let's look at the implication of USAID funding gap. Specifically on global health. I've talked about the general implications for everybody, but now let's look at global health, as it relates to healthcare. The major global health initiatives in Nigeria. What are the major initiatives in Nigeria that we have? Number one is HIV/AIDS treatment because of the PEPFAR project. The PEPFAR project that has been going on for years right now is to help people living with HIV/AIDS to be able to address the challenges better, and it's been having a very good impact. So if this eventually goes through, like we have right now, definitely, the care and treatment of over 1.8 million people living with HIV will be impacted. Almost 2 million people are living with HIV in Nigeria. What it means is that a good number of these people may die. What it also means is that a good number of these people may be thrown into poverty. So beyond that, also the malaria and tuberculosis control program. Malaria is still a major cause of death among under 5 children in Nigeria. We may not have the full capacity to be able to address this. Tuberculosis kills about 250,000 people in Nigeria. This also will impact our people a lot. Maternal and child health care. Nigeria has the third worst maternal mortality rate in the world. What it means is that this may also even get worse if we do not respond to this adequately. Our health system strengthening program in terms of infrastructure development, hospitals, in terms of training and capacity building will also be greatly impacted if this freeze continues the way and we are not able to respond. It's not just about the freeze coming in, it's about how are we going to respond to this, Next slide. Yes. Following my discussion, we've seen that it's a crisis that we have in our hand, it's a challenge we have in our hand, it's a problem we have in our hand. But the key thing is, will Nigeria be able to convert this challenge, convert this threat to us to an opportunity? That is what we need to look at. Are you going to be able to actually take the bull by the horn and convert this threat, apparent threat, to an opportunity for yourself? If you look at most successful people in the world, are usually able, if you listen to the success story of these people, most times the success actually comes from a challenge that they've been able to find a way to stand up to. So let's see how Nigeria can stand up to this challenge and, convert a threat towards an opportunity. But for you to be able to do this, you need to For you to be able to convert a threat to an opportunity, you need to see a threat as it is. But for me, Nigeria is not seeing this threat the way it should see it. The African continent is not seeing this threat the way it should see it. It is then difficult for you to be able to turn it to an opportunity. Because at this point in time, we should be in crisis mode. What we call the cruise mode in business. That's where we should be right now. But that is not happening. What we have seen is that the Nigerian government have responded, which I feel is laudable, which is fantastic, which is good. There's a good response. But we'll still evaluate the response from the Nigerian government to really see, is this adequate enough? Will this be sustainable? I think that's what we need to talk about. There's a response, which is laudable, which is good, but will this response be sustainable? Or is it just a flash in the pan? Will this response be adequate to meet the needs of 250 million people in Nigeria? So now, what I feel is that by now, Nigeria should be in a crisis mode, what I call crisis mode in business, because the reason for this is because some years ago, there have been pointers to international funding coming down some years ago, but nobody did anything. Nigerians government at that time were not standing up to it. This particular government has done well. What the government has done is that they've been able to approve 300 billion naira to the present healthcare budget, which is good. But will they be able to address the issue? And another thing is this: is this sustainable? That's what we need to look at. So
They
now,
don't have money to do that.
in a crisis, the best decisions are not taken during the crisis. We need to understand this. We are already in a crisis. We are now taking some decisions. It's important for us to know that the best time to take this decision was before crisis. The best decisions are taken before the crisis happened. You should have had a crisis team on ground before the crisis happened. So by the time, so the crisis period is not when you begin to set up a team. The problem is that you will not be able to assess every opportunity adequately to be able to take the best chance. Do you understand? You will not be able to put every single opportunity in front of you because you don't have the time. You don't have the luxury of time to be able to take the best option for yourself because you are in a crisis already. So that is the chance we have lost time past. So there are evidence to suggest that there have been warning signs to Nigeria about impending reduction in foreign aid. Evidence also showed that funding from the UK, France, and even Norway, the Norway government, and some other countries have reduced in the last 5 years. We've seen funding from other countries, not just the United States right now, funding from the UK government, funding from the Norway government, funding from France. All these have reduced in the last few years. In the case of Nigeria, we were not prepared enough for this. We should have been prepared enough by discussing before now so that we can have the best chance at having the right response. So now, what is the response by the Nigerian government? I said it earlier. The Nigerian government responded. Even the Ghana government, other parts of Africa, they have responded, which is good. But now we need to look at it. Is the response good enough? Is the response, will it be adequate? Will it be sustainable? Now, number one, there's a human resource response from the Nigerian government. Now, about 28,000 workforce from the USAID have been sent on leave already. So the Nigerian government says that, it's going to absorb these people back into the system. How well this will be done is what we don't know yet, but the government has said that. You know that in Nigeria is one thing to announce, it's another thing to implement. So we need to be able to see these initiatives in action. And it's important for us to also know that, this is where economic factors is really going to play a role, because not everybody is going to be fighting for a scarce resource right now. If we don't find a sustainable plan, everybody, not just healthcare, agriculture, everything, people in conflict, everybody will want to fight from the same resources. This is the reason why I say that it's not just enough to announce this thing, because other people will compete with you to get from the same amount, from the same fund. So it's important that you have a sustainable plan that can give you enough fund. And that's where I'm going to discuss the strategies that we feel that, the Nigerian government and the African government should be looking at. So now there's also a financial response from our government. The Senate, the Nigerian government have approved 300 billion naira to actually, in addition to the present healthcare budget, which I say is laudable, is good, because it was an immediate response. But at the same time, will this be enough to meet our need? Do not forget, 1 billion in US dollars is what we get from USAID. Also, the USA has pulled out from the WHO. So whatever support we get from the WHO also will no longer be there if this thing goes through. Now, the government has also set up a committee to develop a transition and sustainability plan for the USAID funded health program. So now I will say that this is about the most important response from our government, is the fact that there's a committee, a stakeholders meeting that is going on. But now we need to look at it. The stakeholders, does it include everybody that's supposed to be there? This is very important. Now, the stakeholders meeting, whatever that is being done, must put at the center what I call the the SCA model. It must be at the center of their discussion. If this is not really at the center, we may just be seeing that we're just, going in circles. So it's important that certain things are discussed within this committee group, because that is what we feel that will bring about, will enthrone sustainability in whatever action that we are planning. Next slide. So now, bridging the gap, bridging the funding gap, what are the strategies? Now, as I said earlier, the only sustainable way that the government can significantly fund healthcare is by having a stronger economy. Sorry. we need to have a stronger economy. And I think this is the part that we need to discuss. If the economy is not strong enough, whatever strategy we bring on board may not be sustainable, because a lot of people have said so much about PPP, that is public-private partnership. How do you partner with the private sector if the private sector itself is not doing well? That's the reason why I talk about the economy. Chevron, Shell, the SMEs can only support you, can only partner with you if their businesses are not going down. We know the number of businesses in Nigeria that went down because of inflation, because of the tough economic climate. So if we do not improve the economy of the country as a whole, the PPP we are expecting may not be adequate. But if you are able to actually improve the economy, improve the GDP of the country, improve the GNI of the country, more people have more money to spend, the companies are doing well, and for that reason, they can actually partner with you. So this is the sustainable model I feel that we need to look at, having a stronger economy. The only reason why other foreign countries are able to give foreign aid to low-income countries is because they have a strong economy. It's because the UK government feel they have a strong economy. That's the reason why they can take 0.7% of the GNI to send as foreign aid. And it's because you do not have a good enough economy in Africa or in Nigeria, and that is the reason why you are dependent on them. And we discuss it later. It's not because you do not have the resources to succeed, to have the right economy. It's because you are actually not managing your resources well. You are not applying what we call the SEA model very well, which is what? S for sustainability, E for what? Efficiency, and A for accountability. If our government is better efficient in managing their resources, if their government is better or transparent and accountable, if our people in healthcare are better accountable, then definitely we're going to have a better economy. By having a better economy, then you're able to have a long-lasting solution to what? To the funding gap. Just as I said earlier, do not forget, I said 25% of the global entire health spend go down through corruption, go down through wastages. What it means is that if you're able to cut down those wastages, automatically you have about 1.5 trillion in US dollars saved, and you can actually use that. So you don't need what? You do not need aids. So this is the long-term solution to our problem, beyond every other strategy that we may discuss. There can be better provision for healthcare budgets. Once your GDP goes up, once your GNI goes up, you can actually scale up your provision from the present 4% that we're doing in Nigeria to 7%, to 10%. Ultimately, when you meet 15%. When you do this, then what means is that the workforce is better remunerated. It means that there are better infrastructures in the country. When there are better infrastructures, our doctors stay more. When the doctors stay more, then definitely our healthcare system begins to improve. So this is the strategy that I feel that we need to employ. So now, any strategy that does not include a stronger economy as the primary objective will not be sustainable. Foreign aid is only possible because stronger economies are able to give to weaker economies from low-income countries. How do you ask PPP when thousands of businesses are shutting down? So those are areas we need to look at. Next slide, please. So bridging the funding gap strategies in the long term, we need to look at this holistically. Number one, look at the short-term strategies, look at the mid-term strategies and the long-term strategies. This is how to actually address this. These are the recommendations. The short-term strategies include what the government have done. The government has really, have approved 200 billion naira. So those are short-term strategies. They cannot go. It's not even going to be enough. That's the first thing. Not to talk of, the government being able to do that on a regular basis. The government may not be able to do that on a regular basis because there are other parts of the economy that needs the government funds also. Because agriculture is going to be affected. Humanitarian aid is going to be affected. So this is the reason why I said the number one thing, the primary thing that we need to do is to improve our economic growth for the long term. The government needs to find a way to improve its economic growth for the long term. And to do that, you need to be efficient in your spends. When the government is efficient in its spend, what do we mean by efficiency? That means what? Quality goes up. Quality is what the people get. The outcome goes up. The speed goes up, but your cost comes down. Your cost comes down because you do not allocate funds for things that are not very necessary. We all know, without discussing it, we all know the things that the government have done or our people have done in recent time that we feel are not as necessary compared to health compared to humanitarian aid. So when the government is a bit more efficient, when our people, not just the government right now, the people we have in NGOs, the people we have in our hospitals, the healthcare, when they are a bit more efficient, when there's lack of, when corruption goes down, then every money that comes into the economy, we spend it, and this is where we talk about, return. And healthcare being treated as a business. As a business, what it means is that for every spend that comes or that goes out, let's say you spend 100 naira, that 100 naira in a business must give you equal value for what you have spent or superior value. That means it's either I get a value that is equal to 100 naira or I get something even superior. That is when you have actually efficiently spent. But when you spend 100 naira and you get a value of 50 naira, that is a waste of 50 naira. So this is where we need to actually look at, to actually, make whatever we're planning sustainable. Up to a quarter, 25% of the 7 trillion global spending on health is lost to corruption. And this is more than what WHO says is needed to cover what UHC by 2030. Universal health coverage is more than what is needed by 2030, not even now. So really, we may actually not need the funds that we think we need if we are able to plug the holes, if we are able to do away with corruption. And how does corruption come into the system? Absenteeism is part of these wastages in the system when people do not do what they're supposed to do. In the healthcare sector, those are some of the things. Supplies, when there are supplies, drugs and things like that, and people take it away from the PHC and sell it out. When there are these, that is how you actually have a corrupt system. When all this is being addressed, then you can actually improve the system. Next slide. So another strategy that we can look at in the long term is what we call the cost recovery from people living with HIV. That's another thing we need to look at. We need to look at the co-payment structure, what we call co-payment, a co-payment structure, because healthcare is not free anywhere in the world, as I said, and the government is not enough to actually meet, what is needed. The government cannot meet healthcare needs entirely. So you need other sources. So now there's a research that has been done in 2018. The research shows that 92% of people living with HIV were willing to pay for care and medication. So if 92% of people are willing to pay, what it means is that let us get those people to pay for it. If they are able to pay for part of their care, then whatever we get from that, we can use it to fund the vulnerable and the low-income people. So people that are vulnerable, people that are low-income, having HIV, the money we get from what the other people could pay or contribute, we can use it to fund those people. But now there's a way this has to be done. When this research was done, it was found that now, the cost of HIV as released by NACA. NACA is the Agency for Control of HIV and AIDS and things like that. The cost of treating HIV per month was about 5,000 naira. But at the cost of 5,000 naira, not so many people were willing to pay for that. But when they actually tried 3,000 naira, they found out that 92% of the people were willing to pay for it. What it means is that we need a more recent research that will tell us the point at which people are willing to pay for care. If we're able to get that, the government now subsidizes the cost of treatment to that level. When the government does that, whatever contribution we get from these people who are willing to pay, then we use it to fund the vulnerable people and the low-income people. That is another model we can look at. Beyond this also is what we call the equitable access model. The equitable access model, whereby we apply socioeconomic segmentation. That is, we segment people based on their socioeconomic status. We segment people based on, okay, this is rich, this is middle class, and this is low class. Once we do that, we are able to now classify the benefit, whether it's going to be free, or whether it's going to be subsidized, or whether it's going to be full price payment. This is another model we can use. I said healthcare is never free. We just have to be responsible. We just have to be responsive to what we have to do. So the equitable access model is another thing we can look at, whereby we definitely classify people based on their socioeconomic status, and we use that to actually ensure that other people, because if you don't do this, a lot of people who don't have the capacity will die. People that are vulnerable. The statistics tell us that about 60% of our population lives below the poverty line. If these people have HIV/AIDS, what it means is that a lot of these people may die. So we must find a way that will ensure equity, equitability among the people. Then also we now look at private sector collaboration. We talked about that before. The PPP that we talked about, that a lot of people have been talking about. Yes, a lot has been said about the PPP, but this can only happen if the economic ecosystem of SMEs, of businesses, grow and improve. So the government has a lot to do in that area to help improve the business ecosystem for businesses. Then again, inclusive regional and continental engagement and collaboration. Nigeria cannot be in this alone. We need to also partner and collaborate with other African countries. The ECOWAS needs to do something. The AU needs to do something. So that's another thing that needs to be done. They can't just sit down and look. They need to come in and see how everybody can partner together and bring up strategies that will make things better. Next slide. So now I'm going on further. I'll now look at the short to mid-term strategies. People have talked about taxation, but really, with regards to the Nigerian market, how do we tax people when there's a going discussion as at last year, as at this year? We know what the tax matter cost in Nigeria. So talking about tax again, increasing tax should not be on on the table at all. I've heard a lot of things about sin taxes. You want to tax, some class of goods, alcoholic beverages, tobacco, and the likes of that. Do not forget that they all contribute to the economy of the country. And we just have a recent thing done in taxes. So bringing another thing with regards to tax may not be the wise thing to do. Rather, what I will talk about is tax reform, reforming the tax system, whereby you can actually collect more, collection right now, rather than new taxes, or expand your framework rather than new taxes. So those are ways that we can actually still bring in funds that can be used to support the funding gap. Beyond that is health insurance coverage. Let's look at health insurance. Already we have health insurance in Nigeria, but it's not doing as well as it should be doing because the health insurance coverage in Nigeria is very low. It's about 5% or below, thereabout. So the government must find a way to expand health insurance coverage so that it involves everyone, even up to the community level. So those are things that we need to do, and also include some of the things that are not included in health insurance. So some of these global health challenges should be probably be included in health insurance. So those are some of the things the government needs to look at. So in conclusion, without taking much of our time again, as I said, no nation can truly develop its capacity by relying on handouts from foreign countries. If this handout, this is what I feel, this is the positive side I see with all these things happening. I don't like the suddenness, but it's something that it's going to eventually happen. So no nation can truly develop its capacity by relying on handouts from other foreign countries. The truth of the matter is you keep getting handouts. What it means is that you are not developing your own capacity locally to be able to respond. And someday, somehow, these funds will eventually cease. This is just a pointer for us. Even if Donald Trump eventually releases, because I think I got information that there's an order from the court that tells him to release it. But even if that happens, someday it's gonna happen. And we're already seeing a reduction in global aid. So, but right now we need to actually look for a sustainable plan so that we don't need foreign aid from international countries if we do the right thing. So the possible devastative effect of the freeze on AIDS goes beyond healthcare. And I think we've been able to touch on that also. We've been able to show the entire business ecosystem that is going to be affected beyond just healthcare. And this will make us realize that for us to have a sustainable plan, the entire economy must grow. If the entire economy does not grow, what it means is that agriculture is going to come, conflict, security will come, and whatever handout you are thinking the government will give healthcare will be fought for. So that is the reason why we need to look at a more sustainable solution to this problem, which I've recommended earlier. Now, sustainable healthcare funding can only truly be achieved when countries achieve significant economic growth. little break in there. So whatever fund that is released to healthcare for us to spend, definitely we must be accountable for it. Our people are not accountable enough. The NGOs are not accountable enough. So once this is done, then definitely is at the heart of the rising healthcare but bridging the funding gap. Yes. So we now go to recommendation, because the purpose of our discussion today is to recommend what to policy makers, what we feel should be the direction we should follow. That is the objective. So we should be able to recommend courses for the government to follow and things. So I will now go to recommendation. Next slide, please. Next slide. That's about the last slide. So we are almost done. Next slide. Next slide. Hello. Next slide, please.
It's on the screen.
I can't see it. I can only see conclusion. I can't see the last slide, which is recommendations.
Let me share. Let me share. It's showing now.
The screen is blank from here. The screen is blank from here. Or you can just allow me to share, please. If it's giving a problem, allow me to share. Allow me to share.
You can.
No, it's not allowing me to share.
Okay, let me stop now.
Okay. Hold on. Hold on.
Right.
Can you see my screen?
Yes, I can.
Can you see my screen? Okay. So are we on the last slide now? Recommendation, is that what everybody can see?
Yes.
Yes.
Can everybody see recommendations, please?
Yes.
Okay, thank you very much. So now, what are the recommendations right now? So the recommendations to our government, to our policymaker, is that number one, the current stakeholder engagement going on should include a broad group of people, not excluding experts. Experts should be included into this discussion. Healthcare professionals should be included into this discussion. Private sector players should be included, and even the people themselves. It's most likely our people just gather together, the same set of people, they bring them together and discuss. So this may not, you can actually have a more robust discussion if we include more people into the discussion. So definitely we feel that the stakeholder engagement that will chart a transition plan or a sustainable plan should include all these people we've talked about. Then beyond that, also the transition plan should center around and first address the C model we discussed. So it should center around sustainability, efficiency, and accountability. So it should center around sustainability, efficiency, and accountability. So that should be the focus of what the transition plan should be about. Then reading the health system and the Nigerian economy of corruption. This is very important. You need to read the system of corruption. You need to read the system of wastages and inefficiencies. This is very important. And definitely also declaring a crisis mode, or a crisis mode in the sector will help give it the urgency and attention it deserves. Declaring a crisis mode or a crisis mode in the sector will help give it the urgency and attention it deserves. So thank you very much for your time. I hope, I've not taken too much of your time, but I know I took more than 25 minutes. Thank you for having me. Thank you, everyone. Yeah.
Thank you very much, Dr. Ademolu Owoyele, for that comprehensive presentation and a deep insight on today's subject of discussion. Yes, you actually spent more than 25 minutes, but because of the flow of your discussion, I wouldn't like to just interrupt so that the audience can, get the insight to your presentation. So I think a lot has been said. I will just try to give a brief recap before I call on the second speaker, because it's exactly 4:12 now, and this program is scheduled for just 2 hours. So one key thing Dr. Owoyele has mentioned is that firstly, he addressed the problem, the possible challenges that can emanate from the order given by President Trump. So, but one thing he has emphasized and that resonates well with me is that in the first place, African as a continent and Nigeria as a nation, in the first place, doesn't need foreign aid if things have been done properly. And one of the very important model he has extensively talked about, which was one of the reasons why order was given by President Trump's, the gaps, or leakages in not appropriately putting this model in place is one of the reasons why Trump himself also gave that order. And that same inefficiency is what is happening in our system, why we also need to depend on foreign aids to manage our system. And what is the model? That's the C model: sustainability, efficiency, and accountability. So because the resources we have from his presentation and from several data that he presented to us shows that with the resources we have, we are matured enough to address many of these things independently as a continent, as African continent, and also as Nigeria, as a nation, that's specifically Nigeria. So if these things, maybe if our resources have been efficiently managed and there is proper accountability, then we would have been able to develop policies that are sustainable to manage our healthcare system and also other systems that cut across. However, another thing he has also mentioned is that one of the reasons why the short-term solutions that have been put in place by the government may not really work if eventually after the 90 days the order will have to still remain, is that our system currently lacks accountability and there is no transparency in our system. The government of today that we have lack efficiency, lack of efficiency and consideration of putting humanitarian services as their priority. So this model, these three models are one of the very key model that he has extensively discussed, that if we can put this model in place, with that we'll be able to build a strong economy. So because he really talked about building a stronger economy as one of the key things, one of the long-term way of providing solution to the possible implication of this order made by President Trump. And also, another thing he mentioned is the fact that the mindset that healthcare is free, or healthcare is something that everybody must get for free. Actually, this is a theoretical concept, maybe that is used by political people just to get the attention or love from the general masses. But however, in reality, this mindset, it's not something correct or practicable. So there are people, he cited the cases of vulnerable people and people who can actually cater for their healthcare, who can cater for their healthcare welfare. So there are people who have these resources, they can manage for their healthcare. So if the government can put in place system whereby those that can afford healthcare system, there is a system where they are allowed to also put their contributions forward. Then with that, they can use some of these resources to cater for the vulnerable ones. And he also talked about private sector collaboration. So there is also a need for private sector collaboration, and also there are need for collaboration between African governments, so that at the end of the day, we don't need to rely on foreign aid, because either we like it or not, either now or sooner, much later, the foreign aid will definitely come to an end. It's not something that is going to be sustainable for life. So we want to appreciate Dr. Ademolu Owoyele for that beautiful presentation and deep insight on the subject of discussion. So without taking too much of our time, I would like to call on the second speaker, that's Dr. Moussa, to give our own overview of USAID and international funding with regards to Africa. And she's going to give us extensive presentation on the impact on Africa. Dr. Owoyele actually concentrated on the impact on Nigeria as a nation. But what is the impact of this order on Africa as a collective continent, and how Africa should be responding, and suggest some of the innovative ways to bridge the funding gaps among other areas. So, but before I call on Dr. Mary Moussa for her presentation, I would like to read out her profile shortly. So, Dr. Moussa is an Egyptian-born Pan-Africanist, health specialist, and business development expert who has contributed to the development and implementation of innovative and sustainable solutions to improve health outcomes and access to undeserved community on the continent. He leverages her medical background, management skills, and leadership ability to design, coordinate, and oversee multifaceted sustainable health projects engaging partners and stakeholders at all levels of involvement while leading teams across countries of implementation. At AHB, she serves as the head of consulting, leading the team and technical work of AHB, ensuring that the project quality and timelines are met and maintained. Dr. Moussa has a strong passion for advancing human and minority rights, particularly in the area of health, with special focus on gender equality, achieving social justice, and reaching HE, where she designed and led community-centered and country-specific health projects and solutions in Kenya, Uganda, Tanzania, and Burundi. Furthermore, she worked as a medical director and project manager at Afri-Egypt under the guidance of the renowned Afri-Pharma Company, was a project coordinator at SOCHG, a Sudanese non-profit organization that provides health services and advocacies for refugees and migrants in Khartoum and Cairo, plus served as a senior house officer at the Psychiatry Department of Makerere University. Dr. Mary has extensive and valuable clinical and business research experience, both as GP gaining clinical experience in the private sector in Uganda. She has a master's degree in business administration, Eton Business School, ongoing, and also she has a bachelor degree in medicine and surgery, Asyut University, Egypt. And she is a speaker of Arabic, which is her native language, English, and French, including as well as Swahili. Thank you very much. We are honored to have Dr. Mary Moussa to have our presentation. You have 25 minutes for your presentation, ma. You have the floor. Thank you very much.
Thank you, Yusuf. I really appreciate the invitation to contribute to this conversation and this webinar. I would love to say that unfortunately, I won't be presenting, and also because of prior engagements, I'll just give a brief overview, and maybe that will open the floor for discussion on how the aid and the stop aid both has affected the continent. And thank you for the introduction, Dr. as well. Thank you for the powerful presentation. You have covered most of the points actually that I wanted to talk about. But let me say two things. The recommendations that have been offered for Nigeria can actually be applicable for both Nigeria and the continent as a whole. And thank you for also talking about the C approach, which is shedding the light on how we have dealt with aid, which is a short-term solution. We have dealt with it as a long-term solution for our the lack of funding for our own health needs. Let me tell you that in the continent, unfortunately, and I am a strong Pan-Africanist, so I always have been an against aid person. I saw from the beginning that aid is not charity. Aid is a political and geopolitical tool to actually force governments and force countries towards a certain direction that serves the source of the aid, the country that is actually providing the aid, strategy, and aspirations. It's very seldom that we see aid leading to actual development or economic development. So let me take you through a few numbers. I think we have already been taking through like the PEPFAR, how much the USAID fund has been like the amount of funds that have been given through USAID to the African continent. So first of all, less than half of Africa's citizens, and that's over 600 million people, have access to health care that they need. And the continents, unfortunately, the quality of health services is generally medium to poor service, and the family planning needs of the health continents of women and girls are unmet. Other than the family planning, of course, because I do believe that FP is a fund-oriented goal, we are not meeting our service or care that are needed in the infectious diseases theme and the NCDs themes, and we can see also the funds were focusing more into infectious diseases, malaria, TB, rather than diabetes and hypertension, because unfortunately, again, the fund is focused on the funders' priorities rather than the fundee priority. So each year, approximately 97 million Africans, around like 10 or less percent of the continent's population, incur catastrophic healthcare costs. And that is through outbreaks, pandemics, or again, we have a huge NCD burden that is emerging. Particularly, we have seen it in countries like Sierra Leone, Morocco, or Egypt, where I come from. Annually, in the continent of our people are pushed into poverty as a result of these out-of-pocket expenses that they have to incur. So those are few numbers that I wanted to share with you and the attendees. I think we have mentioned that how the USAID has been the largest single donor, which for me is a huge risk. If you have a single donor, it means if that donor disappear or they change their priorities tomorrow, and obviously we can see not lots of African countries had a plan B in place. You are putting your national security at risk. So yeah, approximately the USAID has provided approximately, and we have seen in the previous slides, over 72 billion in foreign aid, and those for what they like to call LMICs between both Africa and Asia. Their humanitarian aid was in health, agriculture, and sometimes security and conflict, and to some extent economic development. Let me also share with you some insights on some countries that has prioritized economic development rather than choosing to put the funds in health. We have an example of India, which has refused to invest foreign money or foreign aid in health, and rather has pushed the funder to invest in economic development. And again, it could be part of our recommendations that we can accept fund. I mean, there is a global responsibility that is shared towards health, global health security, but we can still decide for ourselves where we allocate those funds at. Do we want to invest those funds or put those funds in economic development and economic empowerment of a certain country, or do we want to put them in some sort of like unsustainable and unscalable projects that we all know how those projects are run and how the resources are actually managed. So I'll leave it as a food for thought. The stop work order, of course, was not extremely surprising because in President Trump's previous service as a president, he already has mentioned and already cut funds. And as you have mentioned, globally, countries are becoming more centered around their own needs. And we have seen that in COVID, for example, it was almost each on their own. And countries have decided to invest into their own health security that rather than other countries' health security, even though that we are interconnected. And I will come to that because I also wanted to discuss the effect of the stop aid on the US. So we often talk about the stop aid on Africa, but I think there is huge implication of the stop aid on the US security and health security as well. I mean, I don't need to repeat the PEPFAR project and the implication on the HIV burden on the continent, which is unfortunately is a huge burden to our even health and economic development. Not only did they stop the stop work order has affected all the clinics that is serving HIV patients or the testing that is happening, but also it has affected lots of research programs that are dedicated to find better ways of treating HIV or even preventing HIV. And that is indeed devastating, not only for the continent, but I think around the globe. Let me take you through a few numbers as well on the HIV specifically. So over 300,000 people are receiving daily HIV medication from the PEPFAR. Over also 200,000 tests are performed daily. And we have lots of clients also as a consulting company that are responsible on manufacturing or producing those tests. And for them to enter the market, it's always the funder. It's always fund oriented. It's never supported by the government, unfortunately. And I think it's time for us to relook this whole situation and reassess it and prioritize also our own security and start investing in health because it is our responsibility. It's nobody else's responsibility. Those also services that has been supported by PEPFAR has been focusing on vulnerable populations that sometimes and lots of times actually they are not the focus of ministries of health in our countries. Now we can see it's a 90 days, but it's a 90 days for reevaluation. But we can see from the US foreign policy at the moment that the relationship with Africa is very transactional. So whatever bring them directly translate into monetary value is what they're going to support. Again, the impact on Africa is huge. We need to reevaluate, we need to re-strategize, we need to reinvest, and we need to put the health at the heart of our priorities when we are budgeting, because nobody else will. But before maybe I conclude, because I don't want to repeat what has already been stated, let me share with you a few points that I wrote on the effect of the aid freeze on the US. Again, the fund is a geopolitical tool to position a certain country and to position a certain country's priorities in the funded country. It's never and never will be a charity. So the stop aid decision or order is going to tremendously reshape the US influence on decision making in the countries that receive aid. It might be actually a benefit for us. It might be painful at the beginning, but it's going to give us a chance to have autonomy over our own health expenditure. And to your point, health is never free anywhere in the world. Somebody needs to pay for it. And I'm sure this continent has enough intellectual capacity to somehow redistribute the health expenditure burden between the government, between private sector, between even philanthropies, African philanthropies, not even global philanthropies. So I'm sure we can redistribute that burden, but the magnitude of the stop work is going to, I believe, is going to affect the US more than us. I think it's actually a great opportunity for our countries. Another point that I wanted to mention is the health impact of the disease outbreak. We have seen with COVID that the disease can actually move with us. And yeah, any outbreak that happens in Tanzania, it happens in Egypt, it happens in Sierra Leone, it happens in Uganda, in Senegal, it can definitely travel. And as much as our systems, they look weak and sometimes fragile, we have seen through COVID that more advanced health systems has actually had a higher impact or had the strongest effect from an outbreak rather than ours. We have seen the US systems being influenced. We have seen the UK health system being affected by COVID, but we have seen actually how resilient our health systems in Africa can be. So they might also reconsider how an outbreak in any of our countries can easily travel to their systems as well. The US is actually receiving 300 to 500,000 visitors from the continent yearly. And any of those can be a carrier of a disease that can cause an outbreak, a global outbreak. So not only their sudden withdrawal of funds, that I think is not exactly the best rational methods of reducing the funds or putting America first, is not only going to affect our systems, but it's going to also affect their systems. Health system strengthening projects and programs that includes disease surveillance, that includes like emergency responses that are affected by this order, is going to definitely have an impact, a global impact. So the medication cuts as well, I wanted to mention, is going to affect the resistance of certain strains, that is going to, again, affect the global health security. I think if we look at it from this side, it might not be, the picture might not be as gloomy and as scary. Of course, it's really sad for the people who has been our brothers and sisters and colleagues and cousins that has been reliant on the USAID programs as the source of income. But again, it was a short-term solution that we considered as a long-term one. And it's time for us to change that and absolutely refuse to go back to that corner where our future, the future of our children, is controlled by another country. The AU need to take a stand. The Pan-African entities like Africa CDC needs to take a stand. And I think our ministries can come together. As I mentioned previously, we are not lacking the capacity to redesign and restructure our healthcare financing. I think I'll come to a stop now, and I'll go back to Yusuf and the rest of the attendees of this webinar. I'm really grateful for the opportunity. I'm really grateful for this engagement, and looking forward to hopefully seeing everyone in Africa Health Business Symposium, which is going to happen in July between 16th and 17th of that month in Abuja. Where we're going to actually discuss UHC, and based on the current changes in the ecosystem, in the health ecosystem, we're definitely going to discuss financing, healthcare financing and funding from a Pan-African point of view. Thank you so much once again, and hopefully we will have more engagements in the future.
Thank you very much, Dr. Moussa from Kenya, for that beautiful presentation. And one thing I have enjoyed in her presentation is the fact that she has tried as much as possible to avoid repetition of most of what Dr. Ademolu has said, and she gave a new insight and a different perspective, which is what many of us has not even thought of, because I think so far in most presentations we have only focused on how this order or policy, the impact, the negative impact on Africa as a continent or Nigeria as a country. Meanwhile, she has given a good insight that yes, Africans may be affected, but from the insightful perspective she just gave now, but the effect is going to be for a short term. That is, if the leaders in Africa and the healthcare professionals could seize that as an opportunity. Because one of the challenges we have in Africa is the fact that we don't have autonomy on most of our policies because of the aids we have from these foreign people. So if this can be taken up as a challenge and we can put in place many of the recommendations and possible solutions as mentioned by the first presenter, Dr. Ademolu, so these pains in a short term, though may be very tough, but we are definitely going to get over it. But looking at it in the long term, it has more negative impact or effect on the US government. And she has been able to talk about that, how, because this policy shift is definitely going to weaken the US diplomatic relations with countries that rely on their support. So particularly Africa. So the fact that, because one of the reasons why you will have to, dance to many of their policies is because of the aid we are getting from them. So if this can be taken up as a challenge and we can work out solutions so that we can now stand independently to address many of the problems in our healthcare system, with that we can gain our autonomy, and that will help us to, to the influence these people have over us, will be able to have a rescue from that. So, and also the what's it called? The shift, also the order, will also have an impact on the research industry, because many of these research institutes, they depend on all this funding. So if this funding eventually stops, so the research institute will also be affected. And many countries that depend on the USAID support will definitely sought for alternative partnership with other continents or other countries, and even private organizations, reducing the US influence on global health governance. So thank you very much, Dr. Moussa Mary, for that brilliant perspective. I think that resonates and speaks more to me, and I really appreciate that very important point. So now it's time for question and answer. So just like we mentioned earlier, you can use the Q&A chat box for your question, can direct it to any of the speaker, and they would definitely respond to it. And before that, we don't know if there's anybody from the audience who would like to make one or two contributions. Maybe you have your own opinion to say about today's discussion. We are going to appreciate that. So can we have anybody from the from the participants, you can just signify by raising your hand while we give you that opportunity to also give your contribution. Is there anybody? The Q&A session is open, and if you would like to speak up or read out your question, there is also an opportunity for that. So we have just few minutes left to end today's webinar. So while we are waiting for that, just like I mentioned earlier at the beginning of the program, that one of the key things Harley and Wall Healthcare and Business Consulting Healthcare Entrepreneurship does is this monthly webinar series. So this is just for the month of February. So we will also be having another session in March, as March 29, and the title or the theme for the discussion for March webinar series will be on sourcing financing for business growth, understanding options and requirements. Sourcing financing for business growth, understanding options and requirements. So please, let's keep in touch, and we'll also appreciate your attendance for the March webinar. So do we have any question? Is there any question? Any question or contribution? Okay, I think from Mrs. Zaino. Please, ma, you can unmute yourself and ask your question. Thank you very much.
Okay, good afternoon, everyone. Mine is more of a contribution. So I just want to appreciate Dr. Ademolu Owoyele and Dr. Moussa for the wonderful presentation. And I just want to say that the withdrawal of this U.S. aid by the president of the U.S., we should see it as like an opportunity rather than we should see the positive side of it rather than seeing it as a big negative issue. And it might be a blessing in disguise. And I would just say, I hope the African leaders, and bringing it back to home, Nigerian leaders will see it as an opportunity to look inwards and try to strengthen our healthcare systems and come up with good policies that would make the country and the continent as a whole less dependent on this foreign aid. Because like Dr. Mary rightly said, it's probably, it might not be, not exactly helping the continent. It's more like compelling our leaders to dance to their tune. So if you check the impact, and because of the corruption, the impact doesn't get to the grassroots, doesn't get to the people that actually need this aid the most. It's basically like an avenue for our leaders to loot more funds. So I just want to urge African leaders to see it as a blessing in disguise and have the common sense to look inwards and come up with policies and, you know, basically optimize our resources to take us out of the shackles the West has put us in. So thank you. That's just my contribution, and well done to the presenters. I was really insightful. Thank you.
Thank you very much for that contribution, Matt. Thank you very much. So just like Mrs. Zainab just explained, that it's very important for the government and the healthcare professionals, stakeholders, to see this as a blessing in disguise and as an opportunity for us to, just like when there was COVID. So COVID was really a big challenge for Africa as a continent and Nigeria as a country. But in the span of a short time, we could see a lot of opportunities that the COVID era gave birth to. So, and that's just it. For every challenges or for every problem, there is an opportunity, you know, underneath it. That is, if we can give it an insightful and a critical look. And that is the way it's important for stakeholders, healthcare professionals, and even the government to see this order, even if eventually they may still put, they may still have to sustain it. But just like Dr. Ademolu said, which I believe strongly too, that this aid we get from the international bodies it's not something that we should rely on as a continent. It's very important for us to, as a continent or as a nation, to see how we can make local provisions for many of these challenges. So thank you very much for that contribution. Is there any other contribution from the participant or question before we come to an end of the program?
Mr. Yusuf, thank you very much. I want to thank you, the moderator. You've done a fantastic job of moderating this session. Thank you. You gave very good recap and very good summary of what each of the speakers have discussed. So we want to thank you for this fantastic job. And just to mention that we want to thank the entire AHB team, the Africa Health Business team from Kenya. You know, they are a strategic partner to Harley and War Healthcare and Business Consulting. So we are in a journey together to transform healthcare across Africa, and this is what we're going to be doing for the immediate future, or for the mid to long term. So we have partnered with them. We're going to be leveraging on each other's skills for the nearest future. And I think Dr. Mills, someone mentioned already, we have a symposium coming on, in July. And it's been posted on the chat box over there, so we can take a look at it. I think there's also a link where we can get more information about the symposium. It's going to be mind-blowing, coming up in July in Abuja. So we hope to see everyone there. And definitely there are also benefits for members of the group. When that time comes, we're going to be making it open to everyone. So the HB team with the Harley and World team have actually given an offer for those that will be attending. So we're going to let people know about it. And again, finally, on our screen over there is our March webinar, which is coming up. That graphics over there is not completed, definitely, because normally you're going to see the AHB as a partner on it. So it's not completed. So definitely, but this is just to let people know that the next webinar is going to be talking about financing options. What are the strategies? What are the requirements? What are the options for healthcare practitioners, doctors, and every other person going into healthcare business? So thank you very much from my side. I also leave the floor for you, Mr. Yusuf, as you round up, if there are no further questions from people.
Okay, thank you very much for that important announcement. If there are no further questions and contributions from the participant, I would just like to give a final note or conclusion of what we have been able to capture or cover in this February webinar series. So the webinar has been able to provide a deeper understanding of the policy shift and proactive measures required to navigate these changes effectively. So it is now up to every individual, stakeholders, government, and healthcare professionals and policymakers to see this as an opportunity and take a strategic action that ensures that African health sector remains strong, sustainable, and resilient. Thank you all for your participation and valuable contribution. We hope to see you in our March webinar series. Thank you, the presenter. Thanks to the organizer of the program, Harley and War. Thanks to the two speakers, Dr. Ademolu and Dr. Moussa. And thank you all for participating. See you by March.